6:11 now, and chemotherapy has been a go-to treatment for leukemia for years. But as Rhonda tells us this morning, researchers may have found a more effective treatment for certain types of the disease.
Chronic lymphocytic leukemia is a slow-growing cancer that attacks certain proteins on white blood cells. Now doctors have discovered an alternative to traditional chemotherapy for battling the disease.
Barry Taylor, a retired magician,
Here, I'll squeeze it, I'll make it bigger.
has chronic lymphocytic leukemia, a blood cancer producing too many abnormal white blood cells.
Your spleen and liver can enlarge. Your bone marrow can become packed up with the leukemic cells.
Instead of staying on traditional chemo, Barry's doctors are using new therapies to treat his cancer.
We went from fairly fixed duration therapies to now take it until your disease gets worse again. So we call that treat to progression of the cancer. Now we've kind of come full circle where we're realizing we can put some of these combinations together and we can give them limited therapy that might last only a year or two.
These drugs are critical for outsmarting cancer.
He's on a targeted drug called acalabrutinib, a monoclonal antibody called obinutuzumab, and another targeted drug called Venclexta.
I was in the ICU and all, and things were getting bad. But when I got on this Venclexta, boy, it was a lifesaver.
And now Barry is in remission, but is still on the drug therapies to keep his cancer at bay.
And even more good news here. With these innovative therapies, doctors feel that they may be close to getting a cure.